Welcome everyone. We'll get started in a little bit as more people sign up and get in. So welcome to the community collaboration presentation. And today I'll be speaking about the veterans benefits and a little overview of hospice services at home. Okay, let's get started. So my name is Sung Yoon. I'm a Veterans Hospice Liaison with Visiting Nurse Service of New York. I'm an OEF Army veteran. I was a combat medic from 2004 to 2009. And I currently work with my colleagues, Erica Wigley, Christopher Webster, Joe Vitti, and Frank Quadrino, and we are part of the Veterans Program with Visiting Nurse Service of New York. So today I'll be covering veterans benefits, and we are a member of the NHPCO, the National Hospice and Palliative Care Organization, and HIPCANI. So there are three administrations that provide veteran benefits. So we'll talk more in depth in the next slides, but there are Veterans Benefits Administration, Veterans Health Administration, and National Cemetery Administration. So the veteran service officers and organizations exist in our community. And we have two veteran service officers, Christopher Webster, our CHA Veterans Liaison, and Frank Quadrino, our Veterans Benefits Coordinator. They have decades of experience and they help our veterans are on our program. But the local veteran service officers and the organizations such as VFWs, American Legions, they advocate for veterans and their dependents. So there are national veteran service organizations such as the VFW, the DAV, the PVA, VVA, American Legion. They advocate for the veterans in the community and their members. And then there's state veteran service officers and county veteran service officers. So when it comes to asking a veteran or a family member of a veteran, the first thing that we do when we come across our patients is ask if they're a veteran. And then once they are, they fill out this questionnaire by our social worker during their initial visit. So it asks information such as, did you or your spouse, family member serve in the military? If so, when? What branch they served in, what war era, and their overview view of the military, and whether they would want more information and assistance of the veterans benefits. So the question asks, are you enrolled in the VA? Have you received any of the VA benefits? Do you have a service-connected connection, or do you get your medications from the VA? What's the name of your VA hospital or clinic, and the name of contact of the primary care provider? We work with the VA together while they're on home care services or home hospice services in order for the veterans to be able to utilize both the VA benefits and their Medicare or commercial insurance benefits or Medicaid benefits through home care. So there's two different types of benefits for the retirees and family independents. So not all will qualify, but CHAMP VA is a civilian health and medical program for the Department of Veteran Affairs. And VA shares the cost of the healthcare services and supplies with eligible beneficiaries. So this could be a spouse or a dependent child, but not everyone would qualify, so they would have to meet a certain criteria. And as for TRICARE, it is the program of the Department of Defense, and they're regionally managed. They're split into TRICARE East, West, South, North, And there for active duty and retired members of the uniformed services. Retired meaning 20 years or more of service, or medically retired. So there's compensation and pension services by the VBA, the Veterans Benefits Administration. So it administers a variety of benefits and services for veterans, their dependents, and survivors. So service-connected compensation, monthly payments for their military injury or illness that derive from their military service, a non-service connected pension, we can talk about a little more later with the listed disease and illnesses, the burial allowances, and there's more options when it comes to exploring what benefits that they would qualify for, because every veteran's unique, and their service was not the same. So every veteran would qualify for a certain benefit, but they wouldn't qualify for all the benefits that are available. So disability service connection compensation, by definition, it's benefit because of injuries or disease that happen while on active duty or were made worse by active military service. So certain veterans disabled from VA healthcare, they would receive the healthcare at the VA, and they would receive monthly payments that's non-taxable as well. For certain veterans, receive 0% rating, meaning they can get the medical care at the VA free of charge, but they wouldn't be eligible for payment. So the eligibility, again, is service related disability and discharge other than dishonorable conditions. So the payments determined by the extent of disability, number of dependents, and seriousness of disabled spouse. So these are different types of illnesses and defined by different war periods that they served. So unfortunately, the peacetime war veterans only qualify for certain benefits. But if you look across this table, ALS, Lou Gehrig's is all across the board. So no matter where you served, when you served, all veterans with ALS would automatically qualify for 100% service-connected disability. For World War II veterans, they're going to be in their 90s. Some are going to be older than 100 years old. They were exposed to certain radiation from the atomic bomb. So there are certain cancers and leukemias and Hodgkin's disease that's covered. For the Korean War veterans, there's vascular disease. They have loss of digits or toes from frostbites and Lou Gehrig's. There's also Vietnam War veterans that develop different types of cancers, and especially the lung cancer that affected by exposure to Agent Orange. And Gulf War veterans and OEF and OIF veterans that served in Iraq and Afghanistan, they're eligible for respiratory disorders and neurological disorders. And it's not listed here, but PTSD is one of the service-connected disability that some veterans will qualify depending on their experience and how the severity of how it affects their daily lives. And the other events at Fort Drum, Camp Lejeune, the Cold War atomic bomb radiation exposure, the Vietnam Blue Water naval vessels. That's a small percentage, but it's good to know where they served and when they served, see if they qualify for the eligibility in order to file for the service-connected disability. So dependency and indemnity compensation is paid to the surviving spouse and eligible child of a service person who died while they're on active duty or died due to service-related condition. For example, if they died due to lung cancer and they're a Vietnam War veteran, so the spouse or eligible legal dependent child will be eligible to continue receiving certain portion of the service-connected disability payment even after the veteran passes away. So it is a monthly tax-free benefit, and we help each veteran and their families figure out what they're eligible for as well. So there's also a death pension benefit. So it's a needs-based benefit, meaning they have to meet a certain financial threshold, and it's paid to the surviving spouse and certain eligible children of a deceased wartime veteran as well. So the burial and memorial benefits. So it's a reimbursement for burial expenses. So service connection death up to $2,000 is for service-connected veterans that have 70% or more service-connected disability. And for those that have less than 70%, or it's considered for non-service connected death, the VA will pay $700 towards the burial and the funeral allowance, and it'll pay for $700 for a plot allowance when the veteran's buried in the cemetery that's not under U.S. government jurisdiction. So if they go to a VA cemetery, this plot allowance wouldn't apply, but if they went to a private cemetery, this would. So there's spouse benefits as well for burial. So we look into, if the patient, there are hospice patients who were either a spouse or a veteran, and be able to relay the information so they can prepare well. So the additional death benefits along with payments is the burial flag to drape the coffin and accompany the urn. And it's given to the next of kin as a keepsake. And so we do we request for the funeral honors, presenting of the U.S. flag by the service men and women that's currently serving, playing of taps, and the prudential memorial certificate available to next of kin, relative, and friends. Government headstone and niche marker, and burial at a VA National Cemetery. So the veteran pension, the benefit paid to wartime veterans who have limited or no income and who are age 65 years or older. And if they're 65 and under, if they're permanently and totally disabled, they would qualify. So they have to fill the criteria of being discharged from service under conditions other than dishonorable, and then served more than 90 days of active military service, and 1 day of which was during a war period. So after September 7, 1980, they must have served at least 24 months of the full period for which called or ordered to active duty. So aid and attendance, it's a set aside for a veteran who is determined by the VA to be in need of a regular aid and attendance of another person, or a veteran who is permanently housebound. So they may be entitled to additional disability compensation or pension payments, but it is determined by their financial need as well. A veteran evaluated at 30% or more disabled is entitled to receive additional payments for spouse who is in need of the aid and attendance of another person. So these are some toll-free numbers to reach the VBA, the National Suicide Prevention Lifeline, the healthcare benefits, and headstone and grave markers, telecommunication device for the deaf. So I'll quickly go over an overview of our hospice program, and then we'll have set aside time for any questions. And so feel free to leave your questions in the chat, and after the presentation is over, I'll address all the questions. So Visiting Nurse Service of New York, our hospice program was founded in 1983. So the largest hospice provider in New York City, and we served over 6,555 patients in 2019. So the philosophy of hospice is that at the center of hospice and palliative care is the belief that each of us has the right to die pain-free and with dignity, and that our families will receive the necessary support to allow us to do that. So what exactly is hospice? The hospice term derives from hospes and means to be both the host and the guest, and implies an interaction of mutual caring between the patient, the family, and the hospice staff. So the three main goals is to deliver comfort, dignity, and quality life for the patient and for the family members and the caregivers that are supporting the patient. And our core interdisciplinary team is multiple people working to support the patients and their families at home. So the hospice medical doctor manages the medication, consults to their primary care attending physicians, and they give orders to our nurses that visit, and they're primarily responsible for the physical care, symptom and pain management, and educating the patient and the family. So the social worker also is responsible for the psychosocial assessment and treatment, and they address any concerns regarding financial matters, legal issues, advanced directives, and pre-planning for funeral arrangement. And spiritual care counselor is available, and they'll focus on the spiritual and existential concerns and focus on healing, forgiveness, and sense of meaning towards end of life. So the key concept of hospice care is the 24/7 support. So the family, the patient can call for assistance, and they'll hand off to the supervisor if it's during work hours, or hospice team managers, clinical supervisors, or if it's after hours or evening, nights, and weekend supervisor, triages and evaluates the concern and the symptoms. And if needed, they'll assign a nurse visit for urgent follow-up and visits, or transfer to a hospital if needed. So the evening, nights, and weekend staff provides supportive calls to newly admitted patients, support staff working extended hours, and the crisis care, and phone guidance and problem management, and visits in response to the patient calls, and collaboration and coordination with hospice medical director and other clinicians, and follow-up calls or visits based on a need identified by the COC and other hospice clinicians. So the volunteers, they're required by Medicare COPs, so they must equal greater than 5% of total patient hours by all paid staff. So we have wonderful volunteer teams that support our veterans and non-veterans as well. For this upcoming Veterans Day, our veterans were gracious enough to fill out cards for our veterans and a small token of appreciation. So they provide administrative support, direct patient care services, and having maybe someone to talk to or and spend time for those that request volunteer services. So the hospice services also include the bereavement services, and it's support given to family members for 13 months following a death, and it's provided on an individual basis by phone or in person, and they provide a group session if they wish to participate, and they have monthly educational talks led by our bereavement counselors. So they deal with lack of family and caregiver preparedness as well. As patient declines towards end of life, there's lots of emotions: fear, anxiety, anger, fatigue, depression, lack of adjustment, feeling helplessness, and lack of confidence in their caregiver abilities. And our counselors and our social workers or nurses are there to reinforce that those emotions are not only okay, but to educate on what to do in certain situations as well. So now we'll have time for some Q&A. So Shauna asked, what about the mental health issues and benefits? Yes, so that is a disability. And we at Visiting Nurse Service of New York, we have over 300 social workers that are part of the community mental health, and the veterans can utilize the mental health department for any of there's a veterans crisis line, there's a suicide prevention line, and if their mental disability health issues, this disables them from actually working and being able to conduct daily lives, they can certainly file for a claim for veterans benefits, and depending on their severity and their situation, that would be a claim that's allowed. Are there any other questions? Okay. So these are some of the resources online as well that you can find more about the VA benefits. But feel free to either call or email myself or my colleagues, Erica Wigley, Christopher Webster, Frank Quadrino, and Joseph Vitti, about any other information about a veteran that we can provide. And we'll guide you to the right direction of how to file for certain benefits if they're eligible and what benefits are available. So VNSNY, we are the New York City's largest non-for-profit home and community-based home health organization. And our mission is to improve the health and well-being of people through high-quality, cost-effective healthcare in the home and the community. And we provide care up to 44,300 patients and health plan members daily. So our community outreach programs have served various populations, including the Veterans Chinatown Community Care Center, hospice outreach patients, and provider education, our HOPE program, and New York's LGBT seniors. There's a few more questions that rolled in.
Yes. So there's a question that came in asking if you can discuss aid and attendance versus Medicaid.
So the Medicaid is run by the state. The aid and attendance is run by the VA. So some veterans and their spouses or their dependent children might qualify for both, but it's usually the one or the other. A VSO, veteran service officers, can sit down and kind of crunch the numbers of the income that you do receive monthly or a veteran receives monthly, and see which one they qualify. So the aid and attendance does have a threshold like Medicaid, the financial threshold, but they are two different. So they'll pay up to $2,000 a month. Medicaid, on the other hand, will pay for healthcare services, in the private. So the aid and attendance will directly provide payment to those that qualify financially to help with their, living costs or caregiving costs. So those are the big differences. But it's really good to sit down with a veteran service officers and kind of write down what the monthly incomes are and what the criteria is that the veteran or the spouse is eligible for in order to see if they do qualify for aid and attendance. And there is another message. So the VA pension and the aid and attendance is a little bit different, where the VA pension is also paid to veterans and their family members for those that passed away while they're serving active duty or in a combat, or those that retired from military service after 20 or 20 plus years. so they receive the pension, but they could also receive a pension depending on their disability as well. So aid in attendance is financially driven, so there's a threshold. The pension is not. And there's another question. I've had a PA who had one or the other and need of MLTC. So MLTC, you would have to qualify for Medicaid and Medicare. So because of the age for Medicare, that some veterans are too young to qualify for Medicare just yet, but they might qualify for aid and attendance and Medicaid. So it really, you could reach out to me or to one of my colleagues and we can sit down and see what they would qualify for. Any other questions? Well, thank you so much, guys, for attending. To learn more about the Visiting Nurse Service of New York, please scan the QR code and visit our website.
I believe there is just one last question that came in asking about how long the turnaround time is to get benefits.
So it really depends. If you file electronically, it's a little bit faster, but they're sourcing out to the community as well privately to evaluate and assess. So the turnaround time could be, you know, quick as a few weeks to a few months, but the wait time has been shortened a lot. You know, even with the pandemic, it has been shortened compared to years before. So it really is how much documentation is provided when it's filed, and if they have to keep on requesting additional information, it does take longer. So if everything's good to go, a veteran service officer or organization looked after the claim and then they file it on your behalf, it's much faster. Any other questions? Okay, so we'll end our session. Thank you guys so much for participating in our community collaboration. And I'll provide each one of you with my contact information as well as my colleagues if you have any questions in the future.